Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. Today we are going to talk about another very important topic, and it's known as bronchiolitis. So, what is bronchiolitis? Bronchiolitis is when there is an inflammation happens inside the bronchioles, the small airway, or we can say the lower respiratory tract infections. And most of the cases they are caused by the virus, and most common of the virus is RSV, but certain other viruses can do it too, like adenovirus or parainfluenza virus or rhino or echoviruses. So, what are the risk factors for this infection? Usually, it happens the young babies or infants. If patient has an age of less than 6 months, the chances are the child can have it. Other problems like heart diseases and immunity issues or any lungs diseases. So, how this disease progress? Usually, it's the bad hand hygiene. So what happens is that it's infected through the air, and it can cause rhinuria, rhinitis, as well as pharyngitis, and then this spreads into the lower respiratory system, where it start causing inflammation and decrease the diameter of the bronchioles. As babies have already less diameter of the bronchioles, and they are further stressed due to the excessive inflammation, and it becomes very hard for the child to survive it. So what are the signs symptoms? So young baby usually flaring of the nose, there is continuous coughing, as well as there is indrawing of the muscles and the bones, and it's very hard for the child to have breathing, and they have difficulty in feeding because it's extra burden to eat whenever you have this problem. So how we manage these patients? Usually we see the patient and see the respiratory distress, and we make sure the child can eat easily. So if there is no distress, the child can be sent home. But if the baby is very sick and it's very hard for them to sustain their saturation, we have to keep the patient inside the hospital, and we monitor their vitals. We make sure their oxygen is fine, and sometimes we can give prophylactic medications too. So the course becomes very hard for the babies who are premature or having immune deficiency. They have problem with the lungs, and they have cardiac deficiencies or abnormalities. For them become very hard. So these babies can resaturate, and these babies are not able to eat or drink. So they can end up having dehydration and further problems. So in the treatment, we give the baby oxygen and make sure that it's above certain percentage, and they are hydrated properly because they are not able to eat. So we can put the NG, a nasogastric tube, and baby can be fed through that, or we can give IV medications and fluids. So if we want to talk about prevention, it's also communicable disease, so it can come from one person to the other. So we have to try to isolate the child from the other so that virus is not contagious. At the same time, there are certain monoclonal antibodies which can be used, but especially they are used in Western nations, not in our country, as it's very expensive. So how we can prevent this disease is that we have to keep the premature babies away from the risk factors. At the same time, we have to make sure that our hand hygiene is very good. And in some risk patients, like who are premature, we have to give monoclonal antibodies, and we have to make sure that nobody is smoking around the child. And this is very much, and thank you very much.